Good day! We are Group 1 from BSN 1A1. We are going to demonstrate the proper skill of positioning the patient in supine, lateral, and dorsal recumbent position. So, the proper positioning of the patient is very significant in any hospital settings as promotes safety, comfort, and optimal access. So, correct positioning ensures reduce the risk of falls, injuries that may arise due to improper positioning.
The first position is the supine position. This is considered as one of the commonly used positions in hospital setting. For supine position, the patient lies flat on their back with their face and torso facing upward. Thus, the patient's body is aligned in a straight line with their head, neck, spine, and limbs in a neutral position.
First, wash your hands and put on personal protective equipment. Then, explain the procedure to the patient, ensuring their understanding and cooperation. Also, gather necessary equipment such as pillows, positioning aids, and linens. Assess the patient's condition, mobility, and any specific needs or restrictions. Identify any contraindications or precautions related to the patient's medical history or current status. Clear the area. Ensure the patient's surroundings are clear of obstacles or hazards that could interfere with the positioning or may cause injury. Adjust the bed. Lower the bed to a comfortable working height for caregivers and lock the wheels of the bed to prevent movement during positioning. Place pillows or positioning aids under the patient's head, neck, and knees to provide support and promote proper alignment. Use additional padding or cushions as needed to address specific comfort or pressure relief requirements. Ensure the patient's body is aligned in a straight line with the head, neck, spine, and limbs positioned neutrally. Check for proper alignment of the head and neck to maintain an open airway and reduce the risk of strain or discomfort, and then adjust the bed height, position of the pillows, and other support devices to maximize the patient's comfort. Provide blankets or sheets to maintain appropriate warmth and modesty. Ensure that all side rails are raised and locked, if indicated, to prevent falls or accidental rolling off the bed. Lastly, document the patient's positioning, including any specific instructions, support devices used, and the patient's response to the procedure.
Next is the lateral position. This is where the patient lies on their side with their torso and head aligned. This is important for airway management, prevention of aspiration, and pressure relief.
Prior to performing the procedure, introduce yourself and verify the client's identity using the agency's protocol. Explain to the client what you're going to do, why is it necessary, and how he or she can participate. Perform hand hygiene and observe other appropriate infection prevention procedures. Provide for clients' privacy and safety by ensuring that all side rails are raised and locked. Position yourself and the client appropriately before performing the procedure. While standing on the side of the bed nearest the client, Place the client's near arm across the chest and abduct the client's far shoulder slightly from the side of the body and externally rotate the shoulder. Place the client's near ankle and foot across the far ankle and foot. Lastly, the person on the side of the bed toward which the client will turn should be positioned directly in line with the client's waistline and as close to the bed as possible. Place one hand on the client's far hip and the other hand on the client's far shoulder and roll the client to the lateral position. Then, position the client on his or her side with arms and legs positioned and supported properly with pillows. Lastly, document all relevant information, including the time and change of position moved from and position moved to, any signs of pressure areas, use of support devices, ability of client to assist in moving and turning, and the client's responses.
Lastly is the dorsal recumbent position. This position involves a patient lying on their back with their knees bent and feet flat on the bed or at the examination table. This is commonly used for abdominal and pelvic assessments.
In preparation, explain the procedure to the client and ensure patient comfort and privacy. Also, gather the necessary equipment and ensure the bed's cleanliness and its proper height. Position the patient. Bend the patient's knees, keeping your feet flat on the surface. Then, position the patient's arms comfortably at their sides or on their abdomen, depending on the procedure. And then, provide support for the patient's head and neck if needed, using a pillow or a rolled towel. Next, ensure proper draping for privacy and modesty. Lastly, proceed with the necessary examination or procedure while the patient remains in this position, and record procedure details and any relevant information.